So coming to the next question, which one of which one is the indication which one is indicating the linear contraction rate of polysulfide elastomeric impression material? So the answer is it's B. So this one is A, B, C and D. So this figure would represent uh, the linear contraction rate of the elastomeric impression with the time. So this plot is the linear contraction and this one is the time. So magnitude of the dimension change, it is greater for, remember, it is greater for the polysulfide and C silicon compared to other elastomeric impression like the polyether and A silicon. Now, what is the reason for differential contraction? The polysulfide and C silicon, they experience greater contraction due to the loss of polymerization byproduct, especially water for polysulfide and alcohol for C silicon. So there is loss of polymerization byproduct, especially the water for polysulfide and alcohol for C silicon. So in order to maintain the maximal accuracy with the polysulfide and C silicon material, it is recommended to pour the slurry mix for a stone die or cast immediately into the impression after it is removed from the mouth. So A silicon and polyether, they exhibit stability, allowing impression to be sent to lab for pouring without immediate time constraint. So researchers, they have shown that the casts that are produced from the A silicon between 24 hours and 1 week are as accurate as made in the first hour, assuming there would be no effect associated with the formation of the hydrogen bubbles. Coming to the next question, there is upward rotation of the eyeball when the patient tries to close his right-sided eye. So what do you call it? It's known as a Bell's phenomenon. So the upward rotation of the eyeball when the patient he tries to close the right eye side, it is referred as Bell's phenomenon. So it is a protective mechanism in which the eye they roll upward with forceful defensive closure of the lids. So that is also known as palpebral oculogyric reflex, and it allows observer to notice an upward and outward movement of the eye when he attempts to close the eyeball. Whereas the Bell's palsy, remember, there would be sudden temporary weakness or paralysis of muscle of one side of face. It can involve the facial muscle and it is not directly related to the upward rotation of the eyeball during the eye closure. The next question, effect of calcium hydroxide in pulp therapy. It's the answer is stimulation of fibroblasts from the pulp tissues. Now the calcium hydroxide, we know it has a high pH, right? So option B is wrong. It has a high pH and it releases hydroxide ion, stimulating the fibroblast from the pulp tissue. That is your answer. So this stimulation, it would cause a healing and repair within the pulp. So that leads to formation of dentine bridge. So the calcium hydroxide, it has a bactericidal properties. followed by bacteriostatic growth effect. So that helps to eliminate or reduce the bacteria within the pulp and contributing to the success of the pulp therapy. Apart from that, calcium hydroxide, it will neutralize the low pH of acids, promoting an alkaline environment. So that would support the healing process. Apart from that, the properties are that it stops the internal resorption and it is effective in preventing or treating the root resorption. It is associated with formation of calcific bridge in the tooth where calcium hydroxide pulpotomy has been performed. So these are the advantages of the calcium hydroxide. It is bactericidal and then bacteriostatic. High pH that stimulates the fibroblast. Option C is correct. Promote healing and repairing. Stop internal resorption. Neutralize the low pH of the acid. Apart from that, the disadvantages are it is associated with primary root resorption. It dissolves after 1 year with cavus surface dissolution. There can be marginal failure with amalgam condensation, and it does not adhere to dentine or resin restoration. So these are the one of the disadvantages of the calcium hydroxide. So this table is important. Moving to the next question, identify the syndrome which the radiographic image represent. The answer here is Crouzon syndrome. Well, the Crouzon syndrome, we all know it is caused due to the mutation in fibroblast growth factor 2 receptors. So there will be, that would affect the normal development of the bones and sutures in skull and face. So Crouzon syndrome, the on radiograph you will see premature closure of the cranial sutures, which can be identified through X-rays. So once the sutures they close prematurely, that would restrict the growth potential in those areas. So in the context of question, this radiograph image is indicative of the Crouzon syndrome. Apart from that, you can see is the mandibular prognathism, reverse oversight, etc. So answer is the Crouzon syndrome. Another question, mycobacteria species that are present in dissemination aids, it's the M. intercellulare. So M. intercellulare, it is associated with AIDS. So it is the most common atypical mycobacterium that involves the HIV. Coming to the next question, arrange the zone of the pulp in the correct order. So the first is the odontoblast layer, second is the cell-free zone, third is the cell-rich zone, and D is the central zone. So as you can see here in the pic, the zone of pulp in the correct order, the answer would be A, B, C, D. A is odontoblastic zone, B is cell-free zone, C is cell-rich zone, and D is the central zone. So these are the correct order. A child patient who has a history of trauma and complaints of deviation of mandible to right side. There was history of boil on his right ear. What would be the most likely diagnosis? So the answer is right unilateral ankylosis. So unilateral ankylosis, when there is a fusion of the TMJ on one side. So the patient complains of deviation of the mandible to the right side. So this deviation, it is characteristic of unilateral ankylosis. The history of trauma here it is mentioned, and unilateral ankylosis that results from trauma or infection affecting the TMJ. The presence of boil on the right ear that may suggest a chronic infection that could have contributed to the ankylosis. Apart from that, there is facial asymmetry, roundness and fullness on the affected side that are consistent with the unilateral ankylosis. The mandible on affected side, these further support the diagnosis of the unilateral ankylosis. So answer is A, right unilateral ankylosis. The homonymous hemianopia with macular sparing occurs the most commonly in cerebrovascular accident. What would be the correct statement? The homonymous hemianopia, it is a field loss defect in the same half of the visual field of the each eye. So in context of cerebrovascular accident, homonymous hemianopia most commonly occur due to the infarction of the occipital lobes. So we know that occipital lobes, they are important for processing the visual information, and damage to these area can result in damage to the visual field. So the cause of homonymous hemianopia, it is located at the occipital lobe, followed by injury to the optical radiation or the optical tract. So the answer is C. A forensic odontologist, it is involved in dental profiling. He is performing, the answer is reconstructive identification. So forensic odontologist involved in dental profiling, it is performing reconstructive identification. So reconstructive identification, it is also known as dental profiling or the post-mortem dental profiling. So here there would be, it involves the analysis of dental remains to get the information like race, gender, age and occupation of the desired individual. So that is done before the death, dental records. So this identification, it is typically underdone when before death, dental records, they are not available. Other are the comparative identification. It is most frequently performed examination where the goal is to establish whether the remain of the individual, it matches the dental record of a known individual. Coming to next question, a dentist when treat HIV patient accidentally needle injury occur. The HIV patient have CD4 T cells count less than 150 per cc. What is the treatment of the dentist? So the treatment is that is to initiate post-exposure prophylaxis. So it is a preventive measure to reduce the risk of HIV transmission when a potential exposure occurs. So remember this post-exposure prophylaxis, it should be initiated within 2 hours of exposure, and it should not be delayed beyond 27 hours after exposure. And the effectiveness of post-exposure exposure, it decreases over time after the first 2 hours. Identified the depictive picture. So this picture represents the gubernacular canals. So it is a small canal that is filled with connective tissue and contains epithelial remnants of the dental lamina, and it is associated with eruptive movement of tooth. For vancomycin resistant strain, the answer is linezolid. Linezolid, we know it is a substitute for treatment of infection that is caused by a vancomycin resistant strain, particularly the vancomycin resistant enterococcus. The role of beta blocker in angina, the answer is they decrease the workload of heart. Beta blocker, they reduces the workload on heart by decreasing the heart rate. So that reduces the force of contraction and thereby decreasing the speed of conduction through the heart. So that action that results in decrease in the myocardial oxygen demand. So beta blockers, they are used in management of angina, classic angina, because of their ability to decrease the oxygen demand of the heart muscle. So answer is B. The cleft lip, it occurs due to the non-fusion of the maxillary and the median nasal process. So it is due to the failure of fusion of maxillary prominence and the medial nasal process. Identify the error in OPG. The answer, when the teeth they are placed lingual to the focal trough. So when the head is placed too far backward, that would distort the anterior teeth. The tooth would appear blurred, and when it is placed lingual to the focal trough. So there would be, when it is placed labial to focal trough, remember that occurs when the head is placed too far forward. So remember this table for your entrance exam point of view. Identify the image that is seen here. The answer is a blue nevus. So blue nevus, they are benign and they are usually harmless, and they may be present at birth or develop late in the life. So the term blue nevus, it comes from the characteristic blue to black color that nevus often exhibit. So that can range in color from blue to stale gray. So answer is a blue nevus. What type of bone is present in the anterior maxilla? The answer is C, D3 bone. So D3, remember, it is a porous compact bone and a fine trabecular bone that is found primarily in the anterior maxilla. D1, it is dense contact bone that is composed of all cortical bone, and it is typically seen in anterior mandible. The D2 bone, it is thick porous bone, coarse trabecular bone, commonly located in posterior mandible and sometimes the anterior maxilla. So answer here is D3. The baroreceptor, they have influence in increase the systolic blood pressure. So when there is sudden increase in the blood pressure, the baroreceptor, they get stretched. So increased firing of baroreceptor, they result in inhibiting of the sympathetic drive, and that increases the vagal tone on the SA node of the heart. So increased vagal stimulation on the SA node, that leads to decrease in the heart rate, helping to correct the increase in the blood pressure. A patient with a long history of nodules cavity lesion around with the chest X-ray showing enlargement of mediastinum and a dilation of arch aorta with CA and CA proteinase 3 positive, and a histological slide of vasculitis was given. So the answer is Wagner granulomatosis. So the Wagner granulomatosis, now referred as granulomatosis with polyangiitis, so that would affect the respiratory tract and the kidneys. So here you will see it is characterized by necrotizing granulomatous vasculitis involving small to medial vessels and a presence of the C-ensa proteinase 3. It is a characteristic feature in this. So respiratory involvement with the nodule, cavitary lesions, chest X-ray abnormalities like enlargement of the mediastinum, positive CA and CA with proteinase C specificity. These are the features that are related to the Wagner. The patient needs ocular prosthesis having defect in the socket. Which one would be the best prosthesis to him? The answer is hydroxyapatite integrated ocular prosthesis. So hydroxyapatite orbital implant, it is type of a ocular prosthesis that is designed to replace the missing volume in the eye socket following enucleation. So hydroxyapatite is a biocompatible material that is derived from the marine coral. It is inert, non-toxic and non-allergic. So the hydroxyapatite implant, it is considered an integral implant as it becomes integrated with the surrounding orbital tissues. So fibrovascular tissue growth occurs in the pores of hydroxyapatite that would promote the stability and integration. So due to this biocompatibility of hydroxyapatite, it reduces the adverse effect or the rejection. That is why it has a long-term stability. Following ocular surgery, the implant serves to replace the missing volume in the eye socket, preventing the facial asymmetry and providing a natural appearance. So in summary, the hydroxy integrated ocular implants, they are well established option for patient requiring eye socket reconstruction. So as it has both the cosmetic and the functional benefit. So that would allow integrating with the orbital tissue, promoting stability and allowing for the coordinated eye movements. A patient with coloboma of iris that occurs due to the answer is abnormal fusion of the embryonic optical fissure. So coloboma, it's a congenital ocular abnormality that is characterized by there is a gap or hole in the structure of eye. So in case of coloboma of the iris, there is the iris, that is the colored part of eye, it has a notch or gap. So this condition arises due to the abnormalities during the embryonic development, that particularly related to the closure of the optic fissure or the choroid fissure. A young patient who had undergone extraction of his anterior teeth, after 2 days there was an uncontrollable bleeding despite of applying pressure. So lab finding, they will reveal the factor 7. What could be the deficiency of the factor 7? Factor 8. What could be the most probable diagnosis? The answer is mild to moderate hemophilia A. So factor activity, when factor activity is greater than 5, that leads to the major trauma or surgery. And when this value is 1 to 5, then there is mild to moderate trauma, and less than 1, there would be the spontaneous bleeding. So answer would be when it is 1 to 5, as mentioned in the question, the value is 6%. So it's mild to moderate hemophilia. The functional bevel cusp value is, well, the function cusp value is, it's 45 degree. So the functional cusp bevel, it is placed on the buccal cusp of the mandibular teeth and palatal cusp of the maxillary teeth with an angle of 45 degree and width of 1.5 mm. So that is given to facilitate the proper setting of the restoration. The permanent tooth eruption occurs after when the 2/3 of the root is completed. Initial speech evaluation, if done at what age in the cleft patient? It's the 18th month. So most children will require an intact palate to produce certain speech sound by the 18 months. So the palate, it helps to production of the certain sound speech like such as those involving the pressure buildup, the sounds like P, P, T, D. So by the age of 18 months, the children, they are expected to have acquired a certain range of speech sounds and start combining them to form simple words. Identify the stage of amelogenesis as shown in the figure. The answer is a maturative stage. So this one is the maturative stage. The cells that are present in basal lamina and contain granules and have tactile sensation, they are the Merkel cells. So remember that Merkel cells, they are located in the basal layer of the epidermis and are associated with the sensory nerve endings. So they are tactile or touch receptors. They play in the sense of touch and pressure, typically found in the skin and mucosa. The Langerhans cells, they are dendritic cells that play a role in immune response. They capture the antigen and present them to the T cells and hence initiate a immune response. Melanocytes, they are required for synthesis of melanin. Melanin is a pigment that provide color to skin, hair, and eyes. The altered neural crust cells, they are seen in the mandibular facial diastasis. So reference from Profit, 3rd edition, page 67. Altered neural crust development has been seen in the mandibulofacial diastasis, that is the Traken-Collins syndrome. So in this syndrome, both the maxilla and mandible, they are underdeveloped as a result of generalized lack of the mesenchymal tissues. So that would scantily affect the neural crust cells. So because of the excess cell depth in the trigeminal ganglion, that would scantily affect the neural crust cells. Which of following is the most contagious disease in the India? It's the most contagious disease is tuberculosis. Tuberculosis, we know it's caused by Mycobacterium tuberculi. It is highly contagious, primarily spreads through the air when an infected person he will cough or sneeze. So the infectious particles, they are also known as droplet nucleus, and they can be inhaled by others. That could lead to new infection. So TB commonly affects the lungs, can affect other organs. So the answer is A.